Hi and welcome to our training session on using the hospital passport. My name is Hayley Sharp. I'm a primary care liaison nurse within the Wellbeing Service at CHCP. You may have come across lots of different hospital passports, with each area having their own version. Some care homes locally also have their own version that they use within their care homes for their residents. Ultimately, the hospital passport is a patient's own document that they complete and take with them when they are going into hospital, to see a GP, or just to any health appointment that they are going to. It should highlight the person's care and support needs and anything that health professionals can do to best support them or best communicate with them. This then helps hospital staff to get to know the patient and understand their needs. We were asked to support the Acute Trust to create a recognised document that could be shared across the hospitals in our area. To do this, we worked with a learning disability acute liaison nurse to gather feedback from hospital staff on what they felt needed to be included, as well as working with patients, carers and family members to see what was important to them. Feedback that we received from carers and family members was that although they have completed passports in the past and taken them to appointments, often they feel like the staff don't read them. They also found that often they got lost when their loved one moved to different wards. The hospital staff feedback was that sometimes patients would come into the hospital with really lengthy passports that were 20 pages long, and as much as they would like to have the time to read them, they simply did not have the time. They also found that some patients, particularly those with really complex health needs, were admitted to a ward without any information on how best to support them or how to communicate with them, which then led to patients having a really difficult time in hospital. So we used this feedback to work together to create a more concise document of 6 pages to be used as a snapshot of information on how best to support somebody. The document follows a traffic light system, the red page being things that you must know about me, amber page being things that will help you support me, and the green page being things that will help make my stay better, so things that will make me feel more comfortable during my stay or at my appointment. I'll go through these pages individually within the session when we look at each section separately and what to include. This hospital passport was not created to replace any other important documents that patients sometimes take into hospital with them. Instead, it should run alongside these documents and direct staff to them. So for this, we added an additional information page where patients can refer to these documents, such as epilepsy management plans, bowel management plans, communication passports, respect forms. And when designing the passport, we also wanted to make sure that it was user-friendly. The passport can be completed by the patients themselves or with some support from somebody else. So with this in mind, we created a guidance document to run alongside the passport. This was to support people when filling in the passport, so to think about having those discussions around what's important that we include and just provide people with prompts. We tried to create a document that would be useful for absolutely anybody to use. So whether the person has a learning disability, they are autistic, they have dementia, or they need reasonable adjustments in place. And we called it a hospital passport, but actually this document can be utilised in any way the patient wants. If someone is attending an appointment at the GP practice, it would be really useful to take it along to that appointment as well, as there's information within this document that practice staff will really benefit from knowing. This is a snapshot of how the passport looks, so the red, amber and green pages. The red page, things you must know about me immediately. So these are things that we felt were really important. If a staff member's picking this passport up, they must absolutely read the red page first. This is really important information that can help you support me. The amber page, so things that will help support me. So if the patient is having to have health interventions, if they're having to have different scans, this is information that would really help staff support patients through those processes. So things that will support them whilst they're at hospital or whilst they're at that appointment. And the green page, things that will help make my stay better. So these might be really small things that hospitals can do to make that patient feel comfortable whilst they're in hospital, or things that they can engage with the patient to make sure that they have a positive stay. There's also a link on this slide as well that you can access a digital copy of the hospital passport on. So this can be printed off and filled in, or you can complete it electronically and then you can have it to email out to people. And you can also follow the link to access the guidance notes as well. These are examples of some communication boards that we created. These are also available on that link to print out. They can be used to generate conversation and discussions when looking at what information needs to go in the hospital passport. We found that sometimes people struggle to think about what information to add, what was really important that staff should be aware of. The images that we've provided on the communication board just help people by prompting them to have a think about the support needs that they have. So why is the hospital passport important? It can save lives. We have a video coming up in the next slide from a mum talking about her daughter's experience in hospital and how critical it was that the staff were aware of her hospital passport during her stay and how best to support her. Sometimes we have to do things a little bit differently for some patients, so making sure reasonable adjustments are implemented and that their support needs are met. What works for one person doesn't always work for others. And we shouldn't be saying, oh, that's not going to work for them, or they're not going to tolerate that, so we can't do that. Instead, we should be making sure that we've tried everything that we can, working with the individual, thinking about what reasonable adjustments that we can put in place so that we are successful. Stops people having to repeat information at every admission and every appointment. So patients themselves, parents and carers, they often tell us that they get frustrated having to repeat everything. Sometimes it feels like they're having to revisit their full life story at every appointment. Whereas with the hospital passport, having all of this information in one place, it reduces this. Less stress on the patient and the patient's family and carers. So it means appointments and hospital stays are more likely to be a positive one rather than lots of negative experiences, which then puts people off coming back and engaging with professionals. And it supports hospital staff to feel confident and to know triggers and solutions. Hospital staff often feed back to us that at times they fear getting it wrong. Sometimes they'll avoid communicating because they're worried they'll get it wrong, or they're worried that they're going to offend somebody. People would much rather staff tried and got it wrong than not try at all and then leave the patient feel ignored and not listened to. We're now going to watch a short video of Mum talking about her daughter Victoria and her experience with working with the professionals when her daughter is admitted to hospital.
Well, Victoria was 40 last summer. She's the most wonderful woman you could ever imagine. She speaks with her eyes and eyebrows. She has a rare condition called tuberosclerosis, which means she has epilepsy, kidneys failing. She has a whole range of serious health conditions. Yes. But she still manages to get through life, sometimes with a laugh. Because she is a woman without words, she can't tell us, but we look at her body language and it's telling us, I feel pretty ropey today. Very good. Her staff team have become good detectives in picking up those little nuances that means this woman is not well. Because Victoria has a learning disability and very complex needs, some health professionals may perceive her as not a valued human being and will not offer her the life chances that you and I would enjoy. I'm talking about resuscitation. I'm talking about a simple blood test. One of the most vital tools we find now, alongside the Health Action Plan, is the hospital passport. Is there anything that has changed? In Victoria's health passport is the vital information that you need running out the door to the ambulance. All her medication that she takes, emergencies that she's had before, and what were the triggers and what were the solutions. We bring it up to date every 3 or 4 months, and it's very cost effective in terms of Victoria's health because it's up to the minute information. Very cost effective for any health professional because it's all done for them. It's like an immediate care plan when she goes into the ward. A classic example was when we wanted her to have dental treatment and she needed to be anaesthetised. So we went armed with her hospital passport and we spoke very carefully to the dentist with the anaesthetist, and they could see what had happened before, what were some of the difficulties and what were the solutions. And having read that and questioned us a little bit more, they made the decision. They were prepared for her to have the treatment. Hello, big smile. Sometimes you need a lot of help when people really are not listening. And if they really don't listen, then I seek out these specialist people who come in and really help you.
I just thought it'd be good for us to go through her patient passport. A big part of the learning disability nurse role is essentially to work with families, carers, just to kind of make sure that throughout the person's stay in the hospital that they receive the same standard of healthcare as everybody else. Health passports are really valuable tools for people with learning disabilities. They give the health professional a kind of a one-stop shop information package about that person's health needs. I think it's essential that the hospital recognise the importance of this tool so they can actually feel they're actually part of this process, and as much as possible for them to contribute to it as well.
The impact and the value of having a hospital passport for Victoria is, in some cases, it saved her life. It's certainly aided making decisions. It's caused us less stress. It's helped prepare and make the support workers feel confident. And it's very cost effective for the health professionals. Very cost effective.
So if we look at the hospital passport that we have created and think about some of the things that Mum told us about Victoria in the last video, we can have a look at how we would maybe add this to the passport. So within the red section, things you must know immediately about me. So these are really key, really critical information that we want staff to know. So one of the first things is around communication. So during that video, Mum spoke about Victoria having limited verbal communication. So we're going to add that in there. We might also add that she's non-verbal. Victoria communicates using her eyes, her facial expressions and her body language. So these are things that, because Mum and carers know Victoria really well, they know this. However, staff that are working in a hospital or within a GP practice, they're not going to know Victoria and they're not going to know this. So this is really key information that must be included within the hospital passport. So we might want to be a little bit more specific. So this is just an example that I've come up with. This isn't what Mum said in the video. I just wanted to create a bit of an example of how we could add this to the passport. So if Victoria raises her eyebrows and raises her arms, this usually means that she's happy and that she is saying yes to something. So it might be that she's going out for the day and her carers are getting things sorted, supporting her to get ready, and Victoria is happy to be going out, and this is how she would present. If Victoria is not giving you eye contact, this usually means that she is sad or unhappy, and it might be that we need to work out what's going on for Victoria. So that's when she's not giving us any eye contact. So again, these are really key, important information that must be added to the hospital passport, things that staff can read and that they can pick up and support her while she's in hospital, knowing these facts and these bits of information about her. There's also in there, how will you know that I am in pain? Again, a really important one, and this is from Mum and the carers and how much they know Victoria. They know that they can pick up on small changes within her presentation that they can then work out that that means that she's not very well. So I liked it in the video when Mum said that they've become detectives, and that is exactly how it is sometimes when we do work and support with individuals with complex health needs, with limited verbal communication. We are detectives. We are trying to work out what's going on for them. Are they in pain? Are they happy? What are they trying to communicate to us? So again, just an example that I've come up with. This isn't necessarily something that Mum spoke about in the video, but I've put, Victoria will frown, she'll wrinkle her nose, and she'll grind her teeth. That usually means that she is in pain. So if Victoria does any of these things, then that's how we know that she is in pain. So again, this is really key information that we need to add to the hospital passport. So we then move on to the orange section, which is things that will help you support me. So this is additional information that's going to help staff support an individual in hospital or at an appointment. So there's around their health conditions. So if a patient is going into hospital, it might be that all of that patient's health conditions are on their file, which is fine, but it might be that we want to put key things and key bits of information within the passport just to highlight how serious some of these health conditions are, making sure staff are immediately aware of them. So Mum spoke about some of Victoria's health conditions. We would want to put them in there. And examples, we would put epilepsy management plan if an individual had epilepsy. I think Mum spoke about Victoria having kidney problems, which causes her to have high blood pressure. So if staff are going and doing Victoria's vital signs and they notice that her blood pressure is high, then this is likely to be the cause, but they want staff to be aware of this kidney problem. Also, if any medication is going to be prescribed or any further tests are needed, we want the staff to be aware of these things. There's also a section around support I may need during a procedure or a medical intervention. So thinking about if we are going to have to do some medical interventions with individuals who are likely to become distressed or anxious about these procedures, what is it that we can do to provide comfort, to reduce that stress? It could be just something really small and minor that will make a massive difference to whether that's going to be a success or not. And also we want it to be a positive experience for individuals as well. We don't want it to be a negative experience and then that patient then shuts down completely and we can't carry on and repeat those interventions. So this is just an example that I've come up with. So Victoria does not like having her blood pressure taken or having her bloods done, so becomes really distressed. And this is because she doesn't understand the equipment and she can become really sad and upset when she sees it. However, Victoria likes to hold somebody's hand. I noticed in the video as well that the carers were massaging and tickling her hand at times. There was also massaging her neck near her ears as well. So it might be that if a carer or mum is around and they're able to do that, then actually she will be okay with medical procedures because that will provide her with comfort and will calm her down. There's other things as well, silly little things as well, like I just put in there as an example, Victoria loves ABBA, so playing her favourite ABBA song will help her calm down, distract her from what's going on, and can really make a difference as to whether she engages or not. Other things that you could say as well, be prepared and quick and get it done as quickly as possible as long as it's safe. Sometimes we find that a lot of our patients prefer things to be done a lot quicker, so having everything prepared beforehand can really make a difference rather than a slow process of taking a long time with the medical interventions. As long as it's safe and done so correctly, if we can be prepared and as quick as possible, this often means that you're going to be more successful. So again, these are just a few examples that I've come up with just to get you thinking about what kind of things you could put in there that's going to make the difference for that patient. And then the green page, so things that will help make my stay better. So here we're thinking about Additional little things that we can do to provide comfort, to make sure that the individual has a positive experience, things that they might find upsetting when they're in hospital, so what can we do to reduce that stress? So additional things to help me feel comfortable, just basing this on Victoria, but again, just coming up with some examples that I've made up really. Victoria has her family members and her carers that know her really well and understand her complex support needs. So like Mum said, that they know her well, they're her detectives. They're able to pick up on subtle changes in her presentation. So while she's in hospital, it's really important that somebody who knows her well is always with her. So this is something that we would add in there. So as a reasonable adjustment, Victoria should always have somebody with her by her side to support her while she's in hospital or while she's at appointments as well. So when she's in the waiting area, waiting for an appointment, it's really important that staff are allowed in that appointment with her. Other little things as well, just key bits of information. Who are important to Victoria? So who is it, family members that are going to come and see her? Who is it that are important to her? She has a good sense of humour as well. So when we're engaging with Victoria, making sure we're having a laugh, and she likes to have a joke and a giggle. She likes to listen to ABBA. She likes people to be silly and to dance and sing her favourite songs. So if she is having a day where she's feeling upset or she's maybe a little bit distressed, what can we do to pick her mood up, to make her feel comfortable? We can put on some of her favourite music and we can engage with her, and this can make a difference between then Victoria engaging with other things like medical procedures, like scans and having blood tests done. If she feels like there's a relationship there with the staff in the hospital or within the practice, then she's more likely to engage. And support that I have in the community as well. So like I said earlier, who's important to her, who is involved within her care, and does she have other health professionals involved that we need to make them aware of things that we need their expertise on? So does she have a learning disability nurse in the community? So I've put in there that, yep, she has a learning disability nurse. Her name is, you could put her contact details on there as well, and make sure that she's involved within the care that's going on in hospital with the updates that you're providing to family and carer, making sure that health professionals involved in her care are all also included in that, and that they're all listened to as well. They know Victoria really well, so it's important that we are listening to family members, listening to other health professionals and taking on board their comments and their concerns if they have any as well. How can we help? So there's lots of different ways that we can help. We can make sure that we are encouraging patients to have a hospital passport. We can be helping by completing passports with patients who are unable to do it themselves, promoting the passport at every opportunity. If you are a healthcare professional and a patient attends an appointment or attends the hospital with a hospital passport, we must be reading it. This has got really important information about that individual, how we can support them, how we can communicate with them, so we must be reading it. Ask and promote them. If we are talking to an individual who hasn't brought a hospital passport, we need to be making sure that we are talking about them. So have you heard of hospital passports? Do you have one? Having copies to give out as well. So within LD clinics, what we tend to do is have a handful with us just in case a patient attends the appointment and they are aware of the hospital passports. We can talk about them, encourage them to fill one out, and also give them a copy as well. We have the link that you can go online and you can get a digital copy as well, so we need to be making sure that we're sharing that. And again, I want to highlight the fact that it is called a hospital passport, but this passport can be used in lots of different ways. Any health appointment that the patient attends, at a GP practice. So if a patient attends a doctor's appointment or an appointment at the practice and they bring their hospital passport, there will be information in there that will be really useful to take off the passport and put on the patient's record. So on their home screen, they may have identified some reasonable adjustments that can help them with appointments, with medical interventions, with how best to support them at appointments as well, with how best to communicate with them. So it might be worth having a look through the passport and just taking some key bits of information and implementing them on the patient's record for future appointments and for other members of the practice to see, so that appointments are successful and that those reasonable adjustments have been acknowledged, and then they can be implemented as well. So thank you, that's the end of the session. I hope you found it useful. Please follow the link within this session to access the hospital passport, the guidance notes, and also the communication boards to generate discussion when completing the hospital passport. If you do have any other questions around the passport, then please contact us on chcp.makeitclear@nhs.net and we will get back to you as soon as possible. Thank you.